Great. Thank you very much, and good afternoon, everybody. So numbers update at the state level. We are announcing 695 new people that have been diagnosed with COVID-19 in our numbers today. 382 of these individuals tested positive by PCR and 313 by antigen testing. In the last week, we have averaged around 750 to 800 new infections per day statewide, and the number of people with active infection currently in our state stands at 6,303. That's an increase of almost 2,000 people from a week ago at the same time. Our test positivity rate, again, this is now including antigen and PCR tests combined. The overall test positivity rate is averaging about 9%. Again, that's up from a week ago when we were at around 7%, so that the testing data is demonstrating increasing community transmission. And as the governor alluded to, we currently are at 248 people currently hospitalized statewide. That also is substantially up from a week ago. And then sadly, 14 new people that have died from COVID-19 in the state, 13 of whom are associated with long-term care facilities. This brings the total number of people that have died in New Hampshire during this pandemic to 584 individuals. In the last week, there have been a total of 40 people that have died from COVID-19 in New Hampshire alone in the last week. So we know that community transmission continues to increase, and without a high level of compliance for mask use, social distancing, avoiding social gatherings, avoiding travel, especially around the holidays, the rates of infection and spread within our communities will likely increase. Keep in mind that probably less than 5% of the population in New Hampshire has been exposed to the virus and has immunity or protection. So that leaves a large proportion of our residents in New Hampshire that are susceptible to infection. And so without high compliance to the mitigation measures, the numbers are likely to continue to go up at a concerning rate. And when community transmission is so high, we know that that puts our long-term care facilities, our businesses, our schools at risk for introduction and spread of COVID-19. And so it continues to be the collective responsibility of individuals, businesses, communities to protect our institutions and to protect the vulnerable individuals in our state. And I will hand things now over to the Commissioner. Thank you.
Thank you and good afternoon. Today we are announcing for our long-term care update. We have 3 outbreaks to close: Mount Prospect Academy, St. Teresa's, and Woodlawn Care Center, all closing their outbreak status. We have 14 new outbreaks to announce today. The Corville at Bedford, Carlisle Place, Crestwood Center in Milford, the New Hampshire State Prison, the Men's State Prison, the Elms Center in Milford, Epsom Healthcare in Epsom, Evergreen Place in Manchester, Hackett Hill in Manchester, the Inn at Fairview in Hudson, Lakes Region Community Services Fairview Home in Laconia, Merrimack County Nursing Home in Boscawen, Pines of Newmarket, Pleasant View Nursing Home, Riverside Rest Home, and Ward Health and Rehabilitation Home. So those are all new long-term care or congregate living outbreaks, and we will release our regular chart each week with the number of cases rather than go through every individual. That's all I have. Thank you.